now we're going to look at assessing the wrist. There's a variety of subcomponents of the wrist, so you can check the distal radial ulnar articulation against itself. And all that looks like is we take your arm here. Now this can be done in essentially any position. Slide the bracelet up a little bit just so I don't drive the bracelet into your wrist. There you
Yes.
go. So it's thumb on one, thumb on the other, index finger around, and then it's relational motion. So I move one and keep the other still. I move, then keep the other still and move the other one. So all that looks like is drop, pull up. Now, obviously, when we get down closer to the wrist, this should behave a little bit differently. I am mildly dyslexic about this, but the radius is the thumb side, and I expect it to move a little bit less, but it should be able to move somewhat, right? So in this case, I can pull up, I can't push down particularly well. That's not really abnormal, but they do slide reasonably in relation to one another, so I'm not particularly concerned here. However, in that general palpation, because I've got a broad amount of contact with the region, it does feel as though there's something a little bit lower down. So when we get to that proximal row of carpals, it feels like there's some restriction because again, I've got lots of contact on both sides of that wrist, so I feel something. So then what I'm going to do with the wrist is I'm going to flex it as far as it can go, expecting that the proximal carpal should come forwards and I should feel no hole, right? So as I do that, on this side, it gets full. It's not going to be visible, but there's a hole on this side. You agree with that? So then what I can say is that I can say something along the lines of that most lateral carpal is mildly anterior because we go back to anatomical neutral and then that's the lateral carpal and it's this way, right? So we can name it a variety of ways, but what I know is that I have the expectation that both of these should come forwards when I flex the wrist and one side did not, the thumb side didn't. And then both of these, as I go into extension, there should be a hole on both sides. It should drop down, and in this case, this doesn't drop down particularly well, whereas the thumb side does. So we can talk about the carpals in a variety of ways, but I have my expectation. My expectation is this should come forwards, no hole. There's a hole on the thumb side. This should drop down. There should be a hole on both sides. On the pinky side, there's no hole, right? So I have my basic assumptions of those movements, and when I don't find that, I have some form of assessment finding that I can further zoom into and then generate treatment from.